So I will be discussing, giving you overview of colorism, what colorism is, skin lighting practices and chemical exposures, the impact on communities, and the lack of regulations that we have in our state and federal as well. And then also some of the work that we have been doing. And I'm trying to do all of these within 15 minutes. What colorism is basically skin color discrimination. And so it happens within groups and outside groups. And so when I say within groups, people who share the same race, the same ethnicities, the same skin color can discriminate against each other based on the lighter shades of their skin color. But also outside groups can discriminate individuals based on their skin color. It's a deeply rooted of colonizations, especially those countries that went through colonizations, and then also in the US, the history of slavery. The reason that it's tied to skin lightening is that individuals want to get lighter skin because of the social acceptances that this comes with, but also some of the countries, if you are not lighter skin, your participation in the political system, your participation in economic will be very difficult for you. And so it's a huge factor that makes people to change their skin color. All of these products of skin lightening either contain lead, mercury, hydroquinone, and also steroid. We do know that worldwide, 80% of the sales of these products are bought by women of color. And so we know that the use and the market of these products are very high globally, but also in the US.
We worked with Beautywell for some time. So when we were first starting to think about mercury exposures in Minnesota and what communities might be impacted, what we might want to consider looking for, Amira really played a key role in pointing us to the issue of skin lightening products as an important mercury exposure source, and one that could really be affecting different communities in our state in disparate ways. Working with healthcare providers in the Twin Cities to offer this as a voluntary testing program to pregnant women who are their patients. And we focused on recruiting women from Asian, Latina, East African, and white communities because we were concerned that women from some of those communities could be having higher mercury exposures. Sure enough, we found that there were a number of cases of higher mercury exposures. We do a follow-up where we call them, talk through the results, and then we can offer a home visit. So this is a key piece of the work that our agency does. But that really showed us there were these elevated cases. In most of them, skin lightening seemed to be the likely exposure. There were some communities that were having higher risks for higher mercury. So we found that women from Asian and especially Hmong community, Latina and East African, could be at risk for higher mercury exposure from these types of products. This is a complex issue with so many different threads to it, and we need work on all of those angles. So we need to work on decreasing the demand, so addressing the root issue of colorism. Beautywell is, such an amazing force for this in our state and globally. We need to decrease the supply, so getting the products off shelves, getting them off online marketplaces, and then supporting people who have had a high exposure, offering them this intervention to check their home. We really need work in all of those areas, I think, to effectively address this issue.
I met Amira my very first week at the health department. She came in with a few people from the St. Paul Ramsey County Health Department, and they were concerned about skin lightening creams that were being sold across the Twin Cities and the amount of mercury that was in them. And they had collected samples. They had gone out and bought samples of this and were asking us to test them in our lab. Some of these creams were so powerful that we actually had to take them over to the Pollution Control Agency because their lab was more elaborate and could handle that amount of mercury content. 1 part per million of mercury is considered at the top end. Beyond that is dangerous. Some of these, there was one in particular I remember that had 39,000 parts per million, to give you an idea just how dangerous these creams were, and they were unregulated. Food and Drug Administration, which creates the regulations around this issue, is now active, thanks to Representative McCollum and her efforts, because the funding that comes out that goes to Beautywell and other places in the research comes through Food and Drug Administration, and they write the regulations. Now, enforcing those regulations is up to localities. It's a much more local, state and local issue, and that's going to vary around the country. But we do have federal regulations. We have made great progress on those regulations. It's just, and the enforcement side of it's going to take a while.
I started working on this in 2020. We got some language put in the annual agriculture bill, which funds the Food and Drug Administration's appropriations, after having a great conversation with Amira about what was lacking on the federal government side. So the language that we put in, it established a grant program, and it supported community-based activities like what Amira and other organizations that are out there that have been spearheaded by Amira's work on the effects of skin-lightening programs. So this grant program to date, $1.5 million to several organizations like Beautywell. And 5 years ago, it was zero. In 2022, Congress finally passed the Modernization of Cosmetic Regulation Act. They can do mandatory recalls on cosmetic products that they've determined to be inferior or misbranded because of the exposure that it could cause to, really affect a person's health. And in some places, could even lead to death. Prior to the passage of this law in 2022, the FDA had no authority to do a recall.
The cohort Beautywell has for youth, young women, to address both the colorism, but also the products. And developing leadership in these young women, we are now approaching 200 young women being trained, understanding what the dangers are, understanding the biases, building leadership. And those voices are out there now, going to college, taking jobs, whether they're going to be school teachers, whether they're going to go into public health, whatever they're going into, they're carrying that with them. And those are going to be formal and informal voices to address this issue as well. To me, Beautywell is an example of how one person, in this case, Amira Adawi, took an issue on and is changing the world.
Beautywell is so effective at keeping this issue, front and center where I think it needs to be to move the needle on this concern.
Over the years, we have been training young girls, and they are the future. I want eventually to pass this on to young people, to create this and for them to continuously change this issue. So that's why many of the initiatives that we do centers around youth and young girls, so that we build their leadership, but also their awareness on this issue, so that they lead this issue in the future. This issue requires multiple approaches, multiple interventions. And so it's so important that we think about all of these intersectional areas and to effectively address. We also want the systems to address this issue. And so it will be great to have a strong regulatory systems through our government systems as well. The issue that we work on it's very intersectional issue, and it gets into many different areas. And so I encourage anybody that is inspired by the work that we do to engage us and get involved. So we welcome everybody.